Alright, week 1, part 6, the foot and ankle. We are now going to go over muscles in the foot. However, I am not going to cross the ankle yet. These are just going to be the muscles that are only on the foot. Alright, so I'm going to start with the dorsum of the foot and look at extensor digitorum brevis. Let's see. Alright, I'm going to go quickly through origins, insertions, innervations, functions, and blood supply. You should already know these. You should already be very, very familiar with these and be very comfortable with these. But sometimes we forget things. So I'm going to go through these really, really quickly. Be sure you guys review these and know them well. Alright? Okay, so extensor digitorum brevis, it's going to originate on the superior and lateral surface of the calcaneus, and then it's going to insert down past the metatarsal phalangeal joint onto the first through fourth proximal phalanges. Okay, so the tendon is going to be all the way down there. It's not going to be on the fifth, though. Okay, don't forget we have the extensor digitorum longus that's going to come over more, and he'll help out our and other muscles will help out our little pinky toe. Okay. Alright, so it is innervated by the deep fibular nerve, and then the vascular supply is the dorsal pedis artery, which, as you should remember, is a branch off of your anterior tibial artery. Okay, so one quick thing about your anterior tibial artery and this dorsal pedis branch. So this dorsal pedis branch is the one supplying the extensor digitorum brevis, but it also is really, really good for us in the clinic to start using. I have rarely seen a clinician use it, and I think it is of utmost importance to start using it, but there is a pulse that you're able to palpate right here. So if you feel your metatarsal bones and come in between, slightly proximal, and in between your first and second metatarsals, a little bit more proximal, you should be able to palpate this dorsalis pedis pulse. Now, you will learn something called the antebrachial index in your intro to integumentary course, and they will teach you how to get a numerical value for the amount of blood flow that is being able to go through the patient's limb. So the value that it gives us indicates how much blood flow, how much oxygen and nutrients are getting down to their extremity, and that can be an indicator for us of perhaps someone who has already had an amputation. They could be at greater risk because if the blood flow is not adequate to this distal extremity, then we know that the nutrients and oxygen are not getting to the muscles, and therefore the likelihood of loss of sensation and diminished musculature is likely, and another amputation is likely. So something that you just might want to do while you have your patient models is when you take a look at the contralateral foot. So for your lower limb prosthetics course, whenever you have your patient models, you have to look and do an inspection of their foot that is not that has not been amputated. And when you do that, you're just checking their overall skin, seeing if any ulceration is evident or any discoloration. You're feeling the temperature of their limb and looking for hair loss. Now, additionally, try to palpate this dorsalis pedis. You just want to use your index and middle finger and just lightly push on top of these two of this area where the dorsalis pedis is, and just see if you can feel it. Practice on yourself a few times, practice on someone else, and you want to be able to feel a pulse. It's not going to be nearly as strong as your radial or your brachial pulse that you can feel. It's a little bit more difficult to find, but it's something that you need to be aware of, something that can indicate to you how much blood flow is going into this into their distal extremity. So just take that into consideration. Maybe pull up a video or something on how to find the antebrachial index. You can't do it just based off palpating. You have to use, like a blood pressure cuff. You're doing the same thing but putting a blood pressure cuff on the distal end. So if you want any more information about that, I believe that Dr. Laporte has access to Dr. Laporte has access to these Dopplers that help you hear this pulse, or Dr. Heitzman also will be able to assist you. I know they had mentioned in the past that they wouldn't mind us using their tools from the PT school's equipment room to allow us to find this pulse whenever we are working with our patient models. So just keep that in mind. Know the location of this artery, especially also in orthotics. You don't want to compress this area too much if the orthosis is taking up too much room in the shoe and the patient has a smaller shoe. You know, always tell them they need to have an appropriate fitting shoe, but as well, we don't want to stop the blood flow in this area. Yeah, that's all I have to say about that. Okay. Oh, additionally, this posterior tibial artery is another place that you can palpate for a pulse. So it's going to be a little bit posterior to your medial malleoli. So sometimes if I'm unable to find the dorsalis pedis pulse, then I can find this posterior tibial pulse. Okay, so practice on both of those, see if you're able to find them, and make sure that that's something you are aware of whenever you are working with your patient models. Alright, we are looking at the sole of the foot in the first layer. So remember, there are 4 layers of the muscles on the plantar surface of the foot. So we have one that goes to our first hallux and one that goes to our 5th little pinky toe. And both of these are going to be our abductors. So we have our abductor hallucis and our abductor digiti minimi. Alright, so what are they going to do? They are going to abduct each of these structures. Okay, so our abductor hallucis, we'll just start with that. That's going to abduct the toe, and then it's also going to be able to flex the toe right at the MTP joint. Okay, so its origin is going to be on the medial process of the calcaneus right here. Let's zoom in a little bit. All right, so we have it starting at the calcaneus and then ending on the medial plantar portion of the proximal phalanx. So right here, it's going to cross this joint, okay? All right, and so it flexes the toe and abducts the big toe. Whoa, this is so cool. Okay, oh my gosh, this is crazy. Let's back up a little bit. All right, so then let's go to abductor digiti minimi. Again, it's going to pretty much follow the same path, except it's on the lateral portion of the calcaneus, and it's going to come and cross the MTP joint and insert on the first phalanx. Alright, so abductor digiti minimi, what these guys are going to do is, oh, I'm sorry, not that, that's abductor digiti minimi, flexor digitorum brevis, sorry. So what these guys are going to do is flex 4 toes at the PIP, so at the proximal interphalangeal joints, okay? So you can see they don't cross distally right here, but they cross the proximal joint right here. So they're going to flex at this point. So they're going to be able to do flexion at the PIPs, okay? It's going to start again from the calcaneus in the middle portion and insert on the middle phalanx of the 2nd through 5th toes, okay? Sorry. All right, so let's look at the innervation of each of these. So for our abductor hallucis and our flexor digitorum brevis, both of these are going to be innervated by the medial plantar nerve, okay? And this is a branch of the tibial nerve, all right? And then our abductor digiti minimi is going to be innervated by the lateral plantar nerve, also from the tibial nerve, okay? So all of these are going to be innervated from a branch of the tibial, but our medial portion is going to be from the medial plantar and our lateral is from the lateral plantar. It's pretty easy to remember, but it gets even easier because our blood supply is from the medial plantar artery for the ones that have the medial plantar nerve, and then the lateral plantar artery from the ones that have the lateral plantar nerve. Okay, so pretty much we are going to have, oh my gosh, this is, stop moving. Okay, we're going to have flexion of the 2nd through 5th, abduction and flexion of the 1st, and then abduction and flexion of the fifth also. All right, we have innervations from the median plantar nerve and the medial plantar artery for vascular supply, and then on the lateral side, lateral plantar nerve and artery. All right, so that is the first layer of the foot. Okay, so we are now in the second layer of the foot, and there are two muscles in the second layer of the foot. One of them is not shown in this diagram, but it is quadratus plantae, which pretty much it just helps flex the foot with the flexor digitorum longus because it inserts on the flexor digitorum longus. Okay, so these right here are the lumbricals, so we're not looking at those. But the quadratus plantae starts at the medial portion of the calcaneus, and it's going to insert on the flexor digitorum. It's innervated by the lateral plantar nerve, and the lateral plantar artery is its vascular supply. All right, so let's look at the lumbricals. Like lumbricals in the hand, it allows us to have flexion of our metatarsal phalangeal joint, kind of like in the hand how your lumbricals make the L shape, because it helps to have flexion of the metacarpal phalangeal joints. This is kind of what the lumbricals do as well in the foot. So they are going to insert also, or they're going to originate, on the tendons of the flexor digitorum longus. So remember how I said the longus is all coming down here? They're starting on those tendons, and then they're going to insert on the extensor hoods. So the extensor hoods are these little capsules that help cover, right here, cover the joints and the phalanges. Okay, it's going to be innervated by the median plantar nerve and then the plantar metatarsal artery. All right, so again, it's going to help flex the metatarsal phalangeal joint right here. All right, so that's the second layer of the foot, but no quadratus plantae is shown in here. Alright, so now we are in the third layer of the foot, and just so you know, each of the previous layers are taken off whenever you click on the next layer in this imaging. Alright, so the first one we're going to look at is the flexor hallucis brevis. Now, I don't know if you guys remember me talking about it earlier, but this one is going to run in between and pretty much encapsulate the two sesamoid bones and use that as a fulcrum, because we use this big toe a lot of times for flexion at the metatarsal phalangeal joint. So we have this little guy in here to help with that flexion, okay? And that's why we have the sesamoid bones, to increase the leverage of flexing this toe. So flexor hallucis brevis, it flexes the toe. It starts over here on the cuboid and cuneiform. Well, you can't see it there. But cuboid and cuneiform right here, and it's going to insert again past that MTP joint on the proximal part of the big toe. All right, it's innervated by the lateral plantar nerve, and its blood supply is from the metatarsal artery. All right, so let's go ahead and look at this guy, which is going to be our flexor digiti minimi brevis. Okay, and just like its name says, it flexes the little toe. Okay, so it's going to originate on the base of the fifth, so it's actually going to start on its own metatarsal. It's not going to start from one of the tarsal bones. Okay, and then it's going to come across and cross its MTP joint and insert on the proximal portion. It's innervated by the lateral plantar nerve and from the lateral plantar artery. Okay, so pretty much everything on the lateral side is always innervated by the lateral plantar nerve and frequently has its vascular supply from that artery too. Okay, and then we have one of my favorite little muscles, adductor hallucis. It's going to adduct, so bring this big toe closer to the rest of the other toes, and then that's what the transverse head is going to do, and then the oblique head right here is going to help assist in arch support, and it's going to help with almost not flexion, but some flexion of this great toe. So the transverse head right here, it's going to start, or it's going to have its ligaments in the metatarsal phalangeal joints, so right in between here, okay, of the second through the fifth toes. And then the lateral side of the base of the proximal great toe. So it's going to insert here. So pretty much all, when this contracts, it's bringing this big toe along to the other side. Okay, I don't know if that view helps, but, and then that's going to adduct the big toe. And then for the oblique head, we're starting on the base of the metatarsal, so back down here, and then like the transverse head, it's going to insert on the proximal phalanx of the big toe. So this is innervated by that lateral plantar nerve, and vascular supply is from the first plantar metatarsal artery. So I'll go into more detail on these arteries, things like that. Just knowing your innervations is of utmost importance, especially if we have a patient with a certain spinal cord level injury. It's crucial to know what we do and don't have working so that we can modify our care better towards them. Alright, we have finally made it to the fourth layer of the foot, which has our pads and dabs like that were in our hand. So our dabs, our dorsal interossei, remember dab, DAB, it's because it's on the dorsal side and it allows for abduction. So if I'm able to flip this, it's more on the dorsal side, so these are our dabs that will abduct the toes and help flex the IP joint. So you see how it crosses right here. It's going to help flex that. And so they originate on the metatarsals on each side of them, and then they're going to insert on the proximal phalange of toes 2 through 4. Okay, so none of these are inserting on our first or our fifth. Okay, it's only through the second through the fourth. All right. So this is innervated by the lateral plantar nerve, and it's supplied by the dorsalis metatarsal artery. For our sake, I would just know that it's innervated by the tibial, a branch of the anterior tibial artery. Okay, and then let's go ahead and flip it and look at our pads, which are our plantar adductors. So we have adduction of toes 3 through 5 at the MTP joint, okay? And these are also going to help resist extension. So these are going to stop us from getting too much extension right along here, okay? And we also will have a little bit of flexion at the IP joints too, okay? So these are going to be on the medial side of the metatarsals, and they're going to insert past our MTP joint, okay? Innervation is from the lateral plantar nerve, and then the blood supply is from the plantar metatarsal artery. So that is it. That finishes the muscles that are just the intrinsics of our foot. Nothing that has crossed our ankle joint yet, but more to come. All right.